Good afternoon and welcome to the Dr. Fazil Show. This is our July 2020 edition, our quarantine edition due to the COVID-19 epidemic. We are practicing our social distancing. Thank you so much for joining us today, Dr. Fazil.
Thank you, Wendy, for having me on this show today. And I think we have Jose with us today also as well.
Yes, welcome, Jose.
Thank you for being here. Thank you for being here, Dr. Falzon.
Thank you, everybody. Let's start the panel today. See what's the topic of the discussion today is. Wendy, what is the topic of discussion today?
We're going to be discussing the coronavirus and what we can do to help out our community.
So that's a good question. Let me catch up with the previous episode. We have been talking about, how did the coronavirus epidemic or pandemic started, and the impact on the society, and all the previous development we have talked about, like remdesivir in treatment of coronavirus infection, and then obviously how to protect it by using the mask. And by the way, you might wonder why we have no mask today, because we are not in proximity to any other person at this moment, and we have no audience. So it is a quarantine edition, as Wendy said. So few things have happened since the last month we did the episode, and that was that few new treatments came out. So my goal would be to focus on those new treatments, what could help to combat this deadly disease of coronavirus or COVID-19 infection.
Thank you. Can you discuss with us, or can you explain to us some of the new treatments that have come out recently?
So the new treatment which came out recently, there was a huge study in which they found that the convalescent plasma could be used for the treatment of people who have COVID-19 infection. If somebody is very sick and they're on the breathing machine in the hospital, besides remdesivir, which is one of the medication which just got approved for emergency use of COVID-19 infection, what it does is it reduces your hospitalization by 4 days. That's what the study showed. But what the convalescent plasma is, that if somebody who has COVID-19 infection and they recovered, then they produce some antibodies in their blood known as IgM antibodies, and those antibodies could be used against COVID-19 infection in another patient if we do infuse that plasma into that person.
Dr. Fazil, what's the difference between blood and plasma?
So Wendy, that's a good question. So the blood has two different components. One is known as cells, and the next is the liquid portion of the blood. We call it plasma. So the blood cells are of different kinds: white cells, red cells, and platelets. Each cell type have different function. For example, white cells help to combat infection. Red blood cells carry oxygen to different tissues of the body, and platelets help to stop the bleeding if there's an active bleeding in the body somewhere. While the plasma is a portion of the blood which carries those cells. In addition, that plasma have a lot of other things. A few of them are those antibodies which help to prevent infection. So that's why, if we can remove that plasma, which can be simply done through a centrifugation process, we centrifuge the blood of a person, and the cells being heavy, they get centrifuged aside, and then the liquid portion of the blood, known as plasma, can be given to the patient who needs that if they have those missing antibodies. And we found that it was pretty effective. All those studies are still in progress, but it is promising at this time.
Thank you.
Dr. Fazil, what's the role of dexamethasone for treatment of COVID-19?
Jose, that's a very good question. So there's a recent study done where they found that dexamethasone, which is widely available in all the pharmacies, in all the hospitals worldwide, is a steroid. Actually, it's a corticosteroid. We commonly use it for a lot of other ailments, for example, arthritis and inflammations in the body. The recent study found that dexamethasone, if given to those patients who have COVID-19 infection, it does help them get better faster than without dexamethasone. So that's a big breakthrough, because the medicine is already available if we use it for a limited period of time. It does not have any major side effect, and it does help with the improvement and lower the mortality from COVID-19 infection. So I think that's a very, very important news, and very good news for combating this pandemic, which what we're dealing with now.
Thank you for that information, Dr. Fazil.
You're welcome.
Dr. Fazil, how does such a common medication have so much of an impact on the COVID-19 treatment?
A lot of people do ask that question, and how come we have this medication on our shelves for such a long time, and we have just found out now that this could actually be used for treatment of COVID-19 infection? And the logic is simple. And a lot of damage to the respiratory system happens because of something we call it collateral damage. The virus attacks the cells in the lungs. We call them alveoli, and there are different kind of cells in alveoli known as pneumocytes, and they're pneumocyte 1 and pneumocyte 2. And a lot of damage to the lung is due to the direct attack of those viruses on those lungs. But a lot of damage is also due to our own body reacting against our own body. We call it immune reaction. So that immune reaction causes more damage than the virus caused by itself. And what dexamethasone does is that it stops that collateral damage. It stops our own body reacting against our own lungs, and thus it reduces that production of we call it like exudate, or that junk material around the lung. So our oxygenation is not limited, and we can be cured faster with dexamethasone than without it. So that's how it works.
Thank you.
You're welcome.
Dr. Falzon, moving forward, where do you see this pandemic in the next 3 months or 6 months?
So Jose, that's is a very thought-provoking question. I think it depends on how we react. So this is where we can determine future by our behavior. So if we follow the social guidance, if we do put the mask on, do the sanitization, do the contact tracing, and try to avoid going to the crowds, then obviously we will have less cases. All we're trying to do is buying time. Remember that there's no treatment available at this time, no proven treatment. I know we talked about dexamethasone, remdesivir, and convalescent plasma, but they are not the strong treatments. I mean, they're not like 100% going to work. It's not going to work all the time in 100% of the cases. So there will be some mortality in some patients. So what are we trying to do is to reduce the burden of COVID-19 infection on our healthcare system. So we were just buying time until we get the vaccination or very effective treatment. We have to live with this infection. So we have to learn a new social norm to how to live with this infection. And I think that's what the important point is, that the next 3 months or 6 months will depend on our behavior, because coronavirus is already out there. It's already living with us. The coronavirus is not going nowhere until we have a treatment or vaccination. So that's for given. So the vaccination might take another year. Generally takes longer time. Maybe in this case it might take less time. But the problem is that vaccination is given to the patients which are healthy, and you don't want to give to 7 billion people in the world and half-cooked vaccine, not knowing what you're giving. And even if you get a side effect in 1%, that's a lot of side effects given the size of the sample who we need to give it to. So trying to rush the vaccine might be counterproductive if we're not sure what we're doing. So although we are desperate and we need to do it, but also we have to look at the bigger picture. In the previous epidemics, when the vaccination was given to the population without thorough testing, we found there was some effects, bad effects, and we don't want to repeat the same mistake again. So there's a strict guidelines how you implement vaccination process, but sometimes you have to bypass certain steps, and that is a risky maneuver. My advice would be to prevent it and wait for the right time for vaccination. When we get it tested and thoroughly tested, and then get vaccination. And if we do that, all the steps are done in the right fashion, we're looking at a year and a half before we will have full control on this pandemic. And my other concern is that, okay, what if we have another pandemic from another virus, right? Because the ground is ripe at this time for a second pandemic. I mean, with the travel, with the fast travels, um, um, and again, this virus can mutate as well. So what if this virus mutate, and by the time we get a vaccination, we have another deadly mutation in this virus, and the vaccination which we spend time and money on it is no more good to you or good to the patient? What if? And that what if keeps me awake at night. Yeah, that's what it does.
Dr. Fazel, what are the indirect effects that you are seeing from the COVID-19 virus?
Well, what we have seen that since COVID-19 infection, a lot of patients, they're trying to avoid going to the doctor, um, and which is fine. That's why we're doing telemedicine and try to do anything which we can do on the phone without seeing patient in physical, without being in the physical presence of the doctor or patient in the exam room. But we also have seen that a lot of patients are ignoring other things which can be more deadly in the same period of time. For example, if you have a heart condition, or if you need a mammogram and you miss your mammogram because of COVID-19 and fear of having COVID-19 infection, and then you end up having a breast cancer, that by itself, it has a mortality, and it has a load on the healthcare system. So we see a lot of, again, as I said, COVID-19 infection can cause respiratory infection, but we're also seeing that it is causing strokes, is causing heart attack directly. But the indirect effect of health on the healthcare system is what we don't see, and that what I call it as a tip of the iceberg, is that people are getting other diagnoses, like, if they have abdominal pain and they have appendicitis and they didn't go to the doctor in a timely fashion, and then they die because of perforation of appendix, or other pneumonia which is not COVID-19 and needed antibiotic, and the patient did not go to the doctor in a timely fashion, and that caused poor outcome on the patient's health. So there's a lot of indirect health effect on the patient. Obviously, we know there's an indirect financial impact as well on the businesses. And again, this is not my expertise, but and I'm sure other speakers, when they come available, can talk about it. But my expertise is on the medical profession. So based on that, I will focus on that topic only, and I would recommend that don't ignore your other health issues. COVID-19 could be prevented by using social guidance, but other things might need a hardcore medical examination and treatment. So watch out for those things like heart attacks, control of diabetes, preventive care, and other infections which might not be COVID-19 infection. So please watch out for those things.
So we need to stay vigilant and still continue to stay in contact with our providers and our medical doctors and the specialists we currently are seeing, correct?
Wendy, that's correct. So, there's a few, like in our practice, we have done few innovations. For example, house calls, we start doing house calls where patients are sick enough or fearful enough and they can't come to the doctor's office. So we do the house calls where our nurse practitioners or providers can go to patient home and take care of them there and then, using the social guidance at the same time. Telemedicine has limitations, because on the phone you can do so little. So we have to adapt to this new social norm, and that new social norm is also applies to the healthcare system as well. So we have to just be innovative all the time, and we also have to be vigilant that just COVID-19 is going to here to stay. It's not going nowhere. So we have to adjust our lifestyle accordingly and not become a victim of COVID-19 indirectly.
So don't let the fear cause you to neglect your health, right?
That's correct. That's
Thank
correct.
you.
Yes.
Thank you very much for joining us this afternoon. Again, this is our quarantine edition, the July 2020 edition of the Dr. Fazil Show. Thank you, everybody.
Thank you for having me today, Wendy, in this show. I would strongly advise my audience to stay safe, don't overlook your secondary medical issues, and God bless you, God bless us, God bless all, God bless America, and happy 4th of July, and we'll see you next episode.
All right, everybody, stay safe. We'll see you on the next episode.